All right. Hello, everyone, and welcome to my channel. Today, I have a very special guest, Dr. Previn Panwar, who is my trusted chiropractor. And we're going to talk about the importance of chiropractic care, not just for injuries, but as a proactive practice as we age and the vital role that it has in maintaining our overall health and wellness. So I'm going to just read a little bio for Dr. Panwar. So he was born and raised in Mississauga, graduated from McMaster University, majoring in biochemistry. Furthering his career, he attended New York Chiropractic College in upstate New York. And while in college, he worked with the U.S. Olympic Junior Taekwondo team doing first aid, and then at the Lake Placid Olympic Training Center for running events and community clinics in Buffalo, New York. Dr. Panwar also worked at the Naval Chiropractic Clinic at Camp Lejeune in Jacksonville, North Carolina, as well as the Naval Hospital, rounding with the orthopedic team and urologists there. In 2005, he returned home to Mississauga and joined Credit Valley Chiropractic Health and Wellness Center, which originally started by Dr. Robert Cohen. The practice was very focused on a complementary treatment for arthritis and related diagnosis from spinal mobility and postural perspective. Dr. Panwar's personal interests are running, snowboarding, and skateboarding, and those have been the primary drivers of providing treatments for keeping himself and patients healthy and recovering from active lifestyle injuries. He is one of 3 advanced proficiency rated chiropractors with the activator method chiropractic technique in Mississauga, which is a low force instrument based technique for adjusting someone's spine. And we're going to be talking about that more throughout the session. So Dr. Panwar, let's, welcome to this
Well, thank you for
evening.
that lovely introduction.
Thank
Thank you
you.
for that
And
introduction. I appreciate it.
you've done a lot. And so I love that, you have that US experience and Canadian experience as well. And I'm always, in awe of your snowboarding trips, and you are very active that way.
Well,
Yeah,
thank you. Yeah, I try. That's really what keeps me learning about like how people move and how they get injured, and then you want to enjoy life outside of just your day-to-day stuff. So that's where I test things out.
absolutely. Yeah. So let's start with the basics then. Can you explain what chiropractic care is and the benefits on our health as we age?
Yeah, you know what? There's lots of explanations of how chiropractic works. The best way to understand it is really just understanding it as it's the ability to move properly and restoring your normal movement. So sometimes we forget what normal movement is as we age. So that's what chiropractors do, making sure joints move properly.
Yeah, and I noticed that whenever I come in for an adjustment, I am a bit sore afterwards, but it's because my body's not used to standing properly or sitting properly. And I
Yeah,
think that's what chiropractic care does to me anyway.
yeah. You know what? Like, I think a lot of people will associate chiropractic as a treatment for repair or for injuries. But a better way to understand it is it's just like tuning yourself up, just like the normal use of a guitar, for example, for those who play instruments and music. Just the normal use of the guitar, after a while, it requires a tune up so that it's working better again. And
Hmm.
our bodies are the same way. By doing things in our regular lives, we need to retune, recheck how things are working.
Yeah, because typically, we don't sit properly or we don't stand properly, or even at the dinner table. I remember you telling me, let the food come to you, don't go to the food. Something as simple as that, where, we're doing things, but we're not really doing them properly.
Yeah, that's right. Those daily reminders. I think a lot of us have had parents where they told us to sit up straight. having that awareness is probably like the number one thing to actually improving your spine, your posture, and how you move. But if you don't know about it, you probably won't even think about it. Then things will start to decay over time.
Right. Yeah, definitely. And you use a very different method. And so you use an activator. And so can you explain that approach and any specializations that you have with that? Like, do you have to be a specialized chiropractor to use that activator?
Yeah, definitely good question. I'll show you what the activator is, just so that it's very easy to understand. So
Hmm.
this is an instrument-based adjusting technique. So this little tip makes contact with patients, and then there's a little sound that it makes when we adjust over someone's spine. Um, all chiropractors are trained in what's called diversified methods. Diversified is like using your hands. A lot of people associate that with cracking and twisting the spine and moving
Hmm.
that. Um, it's the same principle about moving joints, but if you think about how someone moves a joint with their hands, and then you figure out what's the minimum amount of force you can do to make the same change. And that's how they came up with the activator method. It's figuring out what's the controlled amount of force to apply, and then what's the specific vector. So, along with the activator method, there's like an assessment. So when you're in the office, you'll see like you're laying on your tummy and you're moving your feet and having you do different movements with your arms and legs. That's the assessment. So it helps determine where to adjust someone's spine. And here's where the sort of professionalism of what a chiropractor does versus just cracking a spine. It's knowing where to adjust and where not to adjust a spine.
Mm-hmm.
And that's really what makes the difference between just randomly moving and cracking joints and then actually having a goal in mind to balance the spine.
Right. Okay. And that's one of the reasons why I came to you is because you use the activator. Anytime, I would see chiropractors cracking and, adjusting manually, it kind of scared me. And so I feel better, with, you using that activator to manipulate my joints and adjust my body instead of using your hands. Yeah. And
Yeah, you're not alone in that. I think a lot of people, like including my own family members, when I initially told them I was going to chiropractic college and
mhm,
they saw what that's all about, you can get very afraid and apprehensive.
yeah.
The technique itself, when you're doing manual adjusting, is very effective, and it's very important to be comfortable with the practitioner you're with. As a practitioner, using the activator method, it provides me a lot of control of variables. So when I'm adjusting in the morning versus when I'm adjusting in the evening, I'm deploying the same amount of force. The vectors are the same. So there's a lot
Hmm.
of consistency in that. So for myself as a professional, it's been very good because I can consistently apply the same results. And I can do this for many years going forward without the toll it takes on my own body.
Right. Yeah, because I mean, yeah, that consistency is important because you're right. Like you might be fresher in the morning and then you get tired as the day goes on. So there could be that, you know, um, that thing that you're not going to apply the same pressure that you did in the morning or those sort of things.
That's right. That can definitely happen.
Yeah. So I think I started coming to you in 2012 or 2013. I think I can't even remember how long I've been coming to you as a patient. And, I have had regular appointments. Some of those appointments were because I had an injury to my back or my knee or my shin. I don't know if you remember when I pulled a muscle in my shin and I had problems even putting my foot down. And, you seem to fix me miraculously. But I didn't only attend when I had something to fix. I maintained my appointments to keep myself proactively healthy. And I can tell the audience firsthand that it has really helped me personally in my posture, my balance, and my overall well-being. And so, even my flexibility, I attribute to my chiropractic appointments. And not only, Dr. Panwar, do you give an adjustment at all of my appointments, but you also give me, and I'm sure with all your other patients, you give us exercises at each visit. And, these exercises are to be done at home, because we all know that, you have to keep up with the exercises on a daily basis for anything to make a difference. So I'm not sure how, if other chiropractors do that as well, but I really, that's one thing that I really like about, your care is that you go that extra step, not just to give the adjustment, but to give, at home care as well.
Yeah, you know what? Like that's really what makes the adjustments hold is kind of the way we describe it. It's almost like if you're trying to realign something, um, you want to then use it in that pattern, and that's
Hmm.
what the exercise is really about, so that that pattern holds longer. Um, I think one sort of misconception people have is when you get adjusted and your body's like perfect, and then you don't want to do anything to disturb it again,
It's
and
so
that's almost
true.
it's almost the opposite. You want to use it in its best aligned shape, and then
Right.
that becomes more consistent that way. Um,
Yeah.
so
Yeah,
that's what the
it's so
exercise
true
is
though.
concerned.
It's like we don't, after an adjustment, I feel like so great that I don't want to ruin it, anything, by doing things. But yeah. And so this is a good segue because my next question was going to be, or my next topic of conversation was going to be misconceptions. And there are so many misconceptions out there. Can
Yep.
you talk a little bit about some of those that, you're familiar with?
Yeah, I think probably the number one idea that people don't express as much, or they don't come to the chiropractic clinic as much for, is because they think it's going to be a painful process.
Hmm.
Like the concept, I think it's become popularized on social media with like cracking and twisting, and that's kind of glamorous to kind of do. Um, but that's what scares a lot of people off as well. And that is something that it doesn't have to be that way. It should not be painful. That'd be very difficult to have a clinic where everyone's walking out in pain. So my goal is to try to make sure people are feeling better at the end. So that's probably the number one misconception. It's going to be a
Hmm.
painful.
Yeah.
Um,
Go ahead. Sorry. Were you going to continue on that or?
yeah, just in part of what you had mentioned about the activator method as well. Like I think a lot of people associated with cracking and twisting, and it doesn't have to be that way to do that. There's actually many methods in chiropractic to allow joints to move, and if you think about it as we're just trying to make sure joints move properly, and you'll find the right practitioner that works with you, the right technique,
Mhm.
will kind of make things
Yeah,
feel better.
and I know, every some of my family members, I'll tell them that I'm going to a chiropractor and they'll say, "Oh, you have to be careful, it might do more harm than good," and all of this, all of these I think it just comes out of fear because they don't know the benefits of it.
That's absolutely right. Usually, they're not going to have like a visual idea of what an adjustment looks like.
Hmm.
So in our office, that's why we actually made it an open concept office. So you can hear what's going on a little bit. You can see what's happening. It's not this scary thing that happens behind a door and there's all these crazy noises.
Right.
None of that going on.
Right, right. Yeah. So, can you talk a little bit about the difference in treatment between injuries and proactive care?
Yeah, that's a really good question, actually. I will say that a large number of the patients that come to us are because they've had an injury. And this is unfortunately coming as a last resort to try out something else, right?
Hmm.
So injuries are where tissue's actually been damaged. And so we have a rehabilitation track for adjustments and for chiropractic care to allow someone to actually heal from
Hmm.
that. Different than wellness and maintenance care, where there isn't necessarily an injury that's occurred, but you're trying to make sure your nervous system is working the best it can. And you'll often hear chiropractors talk about the nervous system. It's basically the way your brain coordinates your body. So we are all familiar. We've got a spinal cord and we've got nerves.
Hmm.
Um, the environment around that spinal cord is where your spine is. So this is kind of the secret behind why chiropractic works. The better you can maintain the environment around your spinal cord, the better and more efficient it works. And that's basically what we're relying on. Um, the chiropractor himself or herself, doesn't actually do the repair. It's your own body, and we're kind of
Mm.
allowing it to do that process.
Right. And so you're just facilitating that repair.
Yeah, exactly.
Yeah. And so why is it so important then to take that proactive approach? And how does chiropractic care fit into that?
So in the 20 years I've been in practice, like I've been lucky enough to monitor a lot of people for the whole 20 years. Um, the proactive approach, what it really does is it allows you to partake in more activities and tasks and basically live more life. That's
Mm,
really the sort of most basic answer behind it. For those that I've seen over the last decades where they didn't have that approach and it was a bit more injury care only,
hmm.
you could see how they will gradually shy away from certain tasks. Their body is not moving as well as it used to. And what happens is they just make choices in life to not do those things.
Hmm.
They will sort of perceive it as this is just how getting older is, but it doesn't have to be that way. There's a lot more potential that they could have experienced.
Right.
So
So yeah, so maybe in like mobility and balance and just an enhanced quality of life. That's what I'm getting from your answer. If you do this proactive, um, then
that's right. It's
yeah,
almost like when your everything is moving well, life is just easy and it seems so simple to do things, right?
right. Yeah.
And when you don't move well, everything is hard.
Yeah.
So,
Yeah, it's like you don't have to think twice about going on that vacation. That involves sightseeing, let's say, compared to, just going on a vacation where you're gonna be sitting on the beach all day. But it's nice to have that flexibility as we age. Because I've been traveling a lot and I've seen, I see a lot of people, in the wheelchairs with walkers, with canes and they're not as mobile and I mean I guess and we all want to travel no matter at what stage we're at or what physical capabilities we have, but it's nicer obviously to travel when you are more flexible and agile and can get around easier.
oh, completely. Yeah. I realized this a lot. I joined a run group many years ago. I used to be just like a treadmill runner at the gym just for personal fitness.
Uh-huh.
And then I happened to come across some people that were part of a run group. I joined them and I went from being just a 3K treadmill runner to running 10K. And then this group was really into marathons. And then I actually ran a marathon with them just by hanging out with them and seeing
Wow.
what
Yeah.
that's like. And one of the things that kind of came about from all this is that we did our first marathon that I joined with
Hmm.
in Portugal. So learning to run, learning about movement allowed me to go on this trip and then being able to sightsee by being able to run and move and not worry about your body. You get
Right.
to experience so many things that you wouldn't have thought were even possible. So that's like my personal reason why I do these sort of things. And then
Yeah.
later on,
Yeah.
it moves on to other sports and activities. But your ability to move makes everything so much more freeing in life.
Yeah, and you don't have to rely on people. And I think,
Right.
sometimes depending on our personality, I know my parents, we went to Florida in June and my dad turned 90 this year and my mom's 83 and they insisted that they were going to walk, in the airport and no matter how slow they were, they were determined that they were going to walk. And I didn't even mention a wheelchair, but they thought I did. And they were just really upset at me because how dare she, she thinks that we need a wheelchair, we can walk. So I love their determination. And, they're pretty. good and at their age to walk. And didn't matter how slow they went, but they went from point A to B, on their own. And it was really great watching them,
Yeah,
even if they did struggle a little bit. But I think for them too, it was an accomplishment, that
definitely.
they felt proud too.
It's very fulfilling. And I've noticed that the opposite effect is true, where people who get relegated to needing assistance and using a walker, it's almost like they fall into that part even more. And they
Yes.
feel like that's what I need to do for the rest of my life, as
Yeah.
opposed to having the courage to step out of that. So it's good on you to have some patience
Yeah.
and then let people kind of take their own pace that way.
Yeah, yeah, a lot of patience. But anyway, yeah, I
Yeah.
survived. So, can you tell the audience about what to look for in a chiropractor and maybe what can they expect in a session?
Yeah. Okay. So that's a very good question because when you go see a chiropractor, you can expect 1,000 different experiences. No one, no one's story is really exactly the same. But
Mm.
in general, when you go see someone, there should definitely be some format of a physical assessment. So they should definitely be taking a look at how your joints move, how your overall health is. There should
Mhm.
definitely be an interview questionnaire about like what your personal goals are and what's the point of why you're coming to see a chiropractor. Being on the same page with your chiropractor is super important.
Mhm.
Uh, Sometimes people will have a less than optimum experience when a chiropractor has one idea of what they should be doing and the person has gone in with a certain set of expectations that they're looking for.
Mhm.
So being on the same page, and this really applies to with any doctor you're working, to make
Absolutely.
sure you're able to communicate. So those are important parts. I think the third part is you have to be able to converse with your doctor, um, be it a chiropractor or your family doctor. You have to be able to freely discuss your health. One sort of misconception is that chiropractic and family doctors are kind of opposites or complement, like allopathic care is one thing and alternative care is another thing. Like these terms don't really make any sense whatsoever. Um,
Right.
I work in a medical arts building. A lot of the doctors, I've known them personally in the building here. So they get a good understanding of what we do. What I specifically do is probably the better answer. So we're on the same team. So you as the patient should get benefit from both sides. But when you're seeing a chiropractor, that's definitely important to converse. And then you should know the technique. Being comfortable with the technique is a super important part.
Mhm.
Because if someone is touching your body, manipulating joints, you've got to be comfortable and relaxed with it. And that comes part and part with being comfortable.
Yeah, absolutely. Yeah, yeah. But I think a lot of doctors are working together, like the allopathic doctors and the, you know, more holistic uh, methods, I guess. I know, with my family doctor, she's very on board with my holistic because I'm not, whenever she prescribes medication, I always say, wait a minute, maybe we can cure this or do something without the medication. And she'll be very honest with me, she'll say, no, for this, you need the medication. Then, you can continue the holistic practices. But the same with a chiropractor, I'm sure. There are, like, I'm not sure, do you prescribe any medication for your patients or, um,
So no, prescribing for medications is not part of the scope of practice for a
okay.
chiropractor.
So that's good to know because, a lot, we don't know what goes on there, right? And it's better to, to be educated and to know that, yes, if my chiropractor is giving me a medication, he's not supposed to, or she's not supposed to.
That's correct. They're not going to be prescribing it. Now, that being said, obviously we work with people who are going through a lot of different types of pain issues and we work with their family doctors or they had a surgery or something like that. So I'm very familiar with all the medications.
Hmm.
And it's important to realize that there is a correct time and place of when to use things and when not to use things. It's not black and white, like, okay, I can solve all problems without medications. That's not true.
Right. Exactly.
But
Yes.
the converse is also true, where it's like you can't solve all problems with all medications. So knowing when to apply the tool correctly is when you'll get the best results.
Right. Yeah.
So
I agree 100%. And a lot of people might think that it's either one over the other. But like you said, you can use it together.
That's right. So there's certain scenarios where you're going to do that. You don't want to leave someone in pain all the time. Like that's an important thing to allow the body to get to the point where it can relax, then it can actually heal and repair. So
Right.
the correct use, like I've worked very closely with family doctors and pharmacists. That's usually a balance.
Hmm.
Because I work with a lot of patients that are older, because we focused on arthritis a lot.
Right.
There's a lot
Okay.
of people who are on medications related to blood pressure, cholesterol, diabetes, and these can affect how their musculoskeletal health
Mm.
works.
Hmm.
So you have to kind of work within those bounds as well, know where their limitations are and how these things can influence their body too.
Yeah. So you mentioned arthritis throughout. So is there anything that, can prevent people from getting arthritis? Or, once you have arthritis, what is there to do? Or how can I don't know, can it be prevented, first of all?
So if we understand arthritis, like we're going to talk specifically about one type of arthritis, which is osteoarthritis. And
Yeah.
osteoarthritis is more of like a wear and tear type condition. So wear and tear with our body is generally a one-way street when it relates to the bones themselves.
Okay.
So when we see arthritis or osteoarthritis on X-rays, um, those are generally not going to reverse. So you want to be able to preserve and maintain yourself as much as possible. That's going to
Okay.
be the best way going forward.
Okay.
But when we see arthritis on the spine, it doesn't mean that that's the end of the world. It doesn't mean that's going to prevent you from functioning well. We can often see people who have advanced arthritis function really well. So
Hmm.
um, it's not that it's a like their fate is sealed and that they're not going to be
Okay.
able to move again. It's actually the opposite, as in you now have a new instruction manual of how your body works. The shape of your bone has changed a little bit.
Hmm.
The muscles are pulling a little bit different. So learning that new instruction manual is really what a chiropractor or chiropractic perspective will teach you. So that's
Okay.
part of the success with arthritis patients. It's teaching them how to use their body in that new body that they found themselves in. And this is why using like techniques for people who don't have arthritis and who
Hmm.
are a lot younger, it doesn't really work. So that generic advice doesn't doesn't work as well. This is where
Right.
you need specific custom care.
Okay. And our bodies are changing.
Yeah, every decade it's like a new manual, right?
It is, yeah, yeah. That's great point. All right. So can you share any other success stories? I know you shared the one where, with your 20-year clients, but do you have any other stories that you can share with us or?
Yeah, you know what? I think some of my favorite clients, like for my own personal self, have been the ones that have reached past the age of 90. And I have about a
Wow.
dozen that I've kind of known along that way because they really shared with me their pearls of wisdom of why and how they got that far,
Hmm.
um, and why they're still on their feet and they're still walking and they're still doing things. And a lot of it had to do with like their personal awareness about their body. Their chiropractic care was one way that they invested in themselves.
Hmm.
Um, like they talk a lot about understanding their own nutrition and learning about their own movements in daily life.
Hmm.
Um, a lot of the ones who are in their 90s did not sort of keep themselves attached to computers and they don't have cell phones.
Yeah.
They're aware of how they work, but they don't make that a primary part of their lives.
Hmm.
And then I see that in contrast with some of my patients in their 20s, late teens, 30s, where they're attached to the computer. Unfortunately, this is one of those things in our lives where it's a double-edged sword. We love it, but then it
Yeah.
also doesn't help our bodies, right?
No. And how do you avoid not using them?
Yeah, it's exactly right. So learning
Yeah.
how to develop our sort of lifestyle ergonomics is important. We have to
Hmm.
remember we're human first, and then our technologies around us. So having a bit of awareness about that goes a long way to kind of protect yourself.
Yeah, yeah. I think it's really important that, yeah, we create those boundaries with our technology, with our, devices, even, putting them away for an hour, because we don't have to be glued to them. Although I think sometimes we feel like we have to, like we are glued to them and we have to be glued to them. But, it's not the end of the world if we miss that email from work, especially when we're at home, after that 9 to 5 period. But, it's sad almost the way society has just kind of instilled that in us, and we have to be on, we have to be attached all the time.
Yeah. So I don't think the technology is going away anytime soon.
No.
So one of the things that I try to tell people about is so you're not going to be able to get away from these devices. You're going to be on your computer, it's going to happen. But when you're thinking about your personal workouts, your personal exercise that you have to kind of reflect on what your day was like. If you are at a computer, you're driving a lot, you're doing these things, your personal workouts are going to be to counteract what that was.
Mm-hmm.
This is where a lot of the exercises I prescribe are related to that. So it's a lot of developing your back muscles, it's developing elongating the anterior neck muscles and how to incorporate that in your workout. So that's kind of the stuff I try to balance out in people's
Yeah.
lives. Because
And
oftentimes telling them not to do it as much doesn't go very far.
yeah, it's important. I mean, because my goal is to live beyond my 90s and to be, very mobile. So
Yeah, that's right. That's the best way.
yeah. Yeah. And unfortunately, I think, the older we get, the more we think about those things. I didn't think about that in my 20s and 30s. I think I started thinking long term in my maybe mid 40s, when I actually felt my body being different, and but
That's
it's never
right. It
too
doesn't
late,
happen.
right?
You're absolutely right. It is never too late. Your human body is forever going to transform and train to whatever you train it to want to be. So that applies to our brain and to our body. I think like from my experience, the one of the best things you can do is interact with people of all ages, the full range. So if you know people in their 80s and 90s, look at what they do that seems successful because
Hmm.
that will be in your future too. And then look back at people in their teens, kids, 20s, and just be able to get a sense of like how the spectrum of movement is, what people do successful, because you're not going to escape that you're a human as well, and you're probably going to fall somewhere in line there. So kind
Yeah,
of pick up on good habits and bad habits, but interact with people of all ages. That's probably the easiest way to learn for yourself.
that's a great tip. Yeah, that's a great tip. Yeah. So do you have anything else you want to add before we wrap things up?
Let's see here. I had a couple of ideas. I think one of the things that's super important is having personal hobbies and goals that are active minded. One
Hmm.
great one is like traveling. A lot of people enjoy traveling, but have something where there's a 5K walk or there's something where you physically have to train up to do that for your travel. These
Yes.
are like very rewarding when you go someplace. And you can practice that at home. Like you can practice your walk through the park, and then you're going to apply that when you go travel somewhere else. But
Hmm.
that makes the biggest difference, like having that confidence, because then it starts making you think about all the things you can do.
Absolutely. Yeah, it's almost like that boost of confidence and that motivation, when you get those. So, when you get the 10,000 or the 20,000 steps in, one day. And, I know it might not be a big deal for you because I know you do a lot of walking and you're very active. But, for somebody like me who I don't quite do the 10,000, although I know I will. Because I
Yeah.
know that's something that you mentioned. But I did one day, and I was in Boston last week, and I did 20,000, and the day wasn't even over, and it was like I was jumping for joy. I was so excited that I accomplished that. So
Oh, that's awesome. Yeah, you know what? That 10,000 steps goal, because I was monitoring my own personal health for like weight gain and weight loss.
uh-huh.
So I've gone through very many times where I've gone up and down, sometimes intentionally, sometimes not so intentional.
Yeah.
But in the last cycle, when I did that about a year and a half ago, That 10,000 steps, I was recording using a Garmin watch. That's what I
Yes,
use
yeah.
for running. And I found that metric, like if you didn't overthink life and you just did 10,000 steps and it was also doing 10 flights of stairs a day,
Hmm.
that was a really good metric about just maintaining your health. And then in this last year, I spent more time thinking about why that was important. And this is kind of a tip about as you get older, when you pass like your 30s and you move forward into the 40s, your muscular strength is now significantly more than your tendon and ligament strength.
Mm,
Get older, people will generally get more joint and ligament problems, not as much like in their muscle belly, for example.
okay.
Those 10,000 steps end up providing just enough stimulus and enough force to stimulate those ligaments and tendons to stay healthy and restore themselves. So every day you're kind of providing that connection point to be stronger each day.
Right.
And you're never going to achieve that without applying those 10,000 steps. It just provides enough time in the day that you've been moving and providing circulation for your body to provide that restoration. So
Okay.
if there's one tip, that's probably a nice, easy, like go for it type thing I can suggest for people
Okay.
that are
Now,
able to walk. Yeah.
now, do the 10,000 steps have to be all in one go, or can it be kind of dispersed throughout the day?
Oh, it can definitely be throughout the whole day. It doesn't have
Okay.
to be like a long session altogether. But
Excellent.
if you can manage a 20-minute walk, um, that is a significantly advantageous thing to do as well. That consistent, mild elevation of your heart rate that provides a lot of benefits. So
Right. And you said
that'd
the
be
magic word, consistency. Consistent. You have to be consistent.
you know what? Just like another point about the chiropractic and having a chiropractor in your life.
Hmm.
Sometimes I find that the thing that helps the most for patients is just having that consistency of someone monitoring your health.
Yes.
Um, I often see patients maybe a few weeks apart, maybe it's a few months apart, but I know their story and their life, and I remind them about what to do. Oftentimes, patients already have all the knowledge, but you just need a little friendly coaching reminder almost,
Hmm. Hmm.
kind of get back to who you know you are. And that's part of the success of why it works is just having someone to kind of remind you back to your own habits that you know about.
Absolutely. Yeah. Yeah. Excellent. Anything else?
I think that's a good note to kind of leave things on. Like
Yeah.
consistency, that's probably the best answer, and that's what gets you longevity as well. Consistency of good habits, right?
Yeah, and that's what we want. We want longevity, but we want longevity in a good way. I can't even think of the word. In an enhanced way that we can live our lives, the vitality that we want, that we
Living that
want to
optimum
keep.
life, right?
Yes, yeah, yeah. So thank you so much, Dr. Panwar. It was
Thank
really
you.
great talking to you, and I'm sure our audience has now knows the importance of chiropractic care. And, all those misconceptions, they can just throw out the window, the benefits of regular visits and how, it can really be a proactive approach to health as we age, and we're all aging. It's inevitable. And so thank you also for sharing those practical tips for finding a chiropractor,
Oh,
and
definitely.
what to expect during a visit. And if the audience, if you have any questions or want to share your own experiences with chiropractic care, please leave a comment below. And if you're interested in exploring chiropractic care, consider reaching out to Dr. Panwar, or a chiropractor near you. I will have all of Dr. Panwar's contact information below in the description. And Dr. Panwar, again, it was a pleasure talking with you this evening. And thank you all for watching. And don't forget to like, subscribe, and hit the notification bell for more wellness content. So, Dr. Panwar, thanks again. It was a
Thank you very much,
pleasure.
Christina. Really appreciate it.
See you next time on The Balanced Path.